So let's start the session with the Dharmantri prayer. Om Namami Dhanvantarim Adidevam Surashurvandit Padpadvam Loke Jararuku Bhaimrityunasham Dhatarmisham Vividaushadinam. So today we are going to discuss how can we improve our immunity with the Ayurveda and Marma therapy, and how can we keep away the COVID-19 virus and all the other viral diseases and bacterial infections. So let's start the discussion. When someone is suffering with any respiratory attack, especially when we talk about the COVID-19, so the COVID-19 is not affecting to each and every person. COVID-19 हर किसी व्यक्ति को affect नहीं कर पाता. Only the person having low immunity, only the person having low immune system, low immunity, they get affected by the COVID-19 or coronavirus. So whenever anyone is suffering with the COVID-19, so the first symptoms come in the body, that is happy hypoxia. Happy hypoxia. The meaning of happy hypoxia means decreasing the oxygen level, decreasing oxygen level in the body. हमारे शरीर में ऑक्सीजन लेवल कम होने लगता है कोविड-19 के अटैक से. Generally, when we go to the hospital, so doctor check with the help of oximeter the oxygen level of our body. It should be between 95 to 97. It should not less than be. It should not less than 95 to 97. What is happening with the patient suffering with the attack of COVID-19? The oxygen level is decreasing day by day, but he is not having any symptom, not having any symptom. Just he feel little sore throat. That's it. Sometimes he realize after 10 days, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Sometimes he realized after 10 days that he is suffering with the COVID-19. So this condition is called happy hypoxia. So in the happy hypoxia, what happened? The oxygen level of the body is decreasing, but patient is not feeling any problem. Patient is not at all having any problem. Then suddenly, when it dropped down too much, then he's getting lots of symptoms together. And he's rushing to the doctor. Then he's rushing to the doctor. So this condition has been explained as a happy hypoxia. इसी को हम हैप्पी हाइपोक्सिया कहते हैं. तो सबसे पहले जो कोविड-19 वायरस, क्योंकि हम जानते हैं इसका नाम ही है कोरोना, बिकॉज इट इज हैविंग लॉट्स ऑफ हॉर्न्स. Go in the from the T point. What is T point? So this is called T point. So the most time the people are getting this infection either from the eyes or from the nose. So if this virus is going from the mouth with the eating material, then it is not creating any problem. They're not creating any problem. Because the acid in the stomach having capability to digest and kill it, digest and kill the pathogen. पेट का एसिड, पेट में जो HCl होता है, ये इस पूरे बैक्टीरिया और वायरस को किल कर देता है. Because in our stomach we are having 1.5 to 2.5 very highly acidic atmosphere. तो अगर आपने कुछ ऐसा खाना खा लिया जो कोविड-19 से अफेक्टेड है, so there is always lesser chances to get infected. So that's why we always tell that COVID-19 infection most of the time goes from the T point. So this is the T point. ये इस T point से जाता है. तो इसीलिए हम कहते हैं कि अपना मुंह को ढक के रखो और आंखों को भी ढक के रखना चाहिए. So we should be secure these places. So initially patient is suffering with a dry cough, little bit breath problem, and after some time, after certain time, when these viruses no, we cannot breathe from the mouth, because the thing is there is a lesser chances if we eat something, but if we are breathing the air from the mouth, because air having the quality to spread all around, so even from the it may affect your throat region, because that passage is common. So airs we should not breathe from the mouth, it is very dangerous. But sometime what happened, this has been seen that the rather than a food material, air is more dangerous. So when what happened, this virus attack, so in our body everywhere, like this is the skin, like either this is the nose skin or this is the throat skin. In the skin, especially we talk about the nose, we are having hairs, hair-like structure. Even if we go in both the lungs, so let's see both the lungs in the next image. So if we see the lungs, so first what happened? First, this virus is entering from this T point most of the time. Then either this may infect the sinuses or throat. So person will have sore throat. This is the initial sign, sore throat. But it is very difficult to find out in this condition because even before COVID-19, people are suffering with a sore throat. Sore throat तो बहुत पहले से लोगों को होता है, ऐसा तो है नहीं कि अभी से ही चालू हुआ है. So this may be the sign of COVID-19, but until and unless we examine it, we cannot confirm it. Then slowly this virus is going inside the lungs. If you see the lung, it is very complex structure. Let's see here. So when we inhale something, it is going from the nose, then it is going to the throat, then it is going in the pharynx, then it is going in the larynx. This is the air pathways. Then it is going to the trachea. Then there is a two partition, right bronchus and left bronchus. Then it is going in the right lung and left lung. Now, even this is the trachea. This is the right bronchus, means right branch. And this is the left bronchus. Now, after that, there is many branches of this. Then again branches. Then again branches. So there are branches and branches and branches and branches like a grapes. So finally, we are having one bag or air sac that is called alveoli. Alveoli. So whatever we are breathing, it is coming till this level. And alveoli should be always empty. It should be empty and vacant. So we can see here in this image, let's see how air is going from the nostril till the alveoli. So we can see in this image, this is the last structure where our air is going. At the same place, we can see there is exchange is happening with the blood vessels. So when we are breathing, so whenever we are breathing, and we are breathing from the nostrils, then that breath go inside the lungs and the carbon dioxide is coming out. This is the simple process of breathing. So when air go inside and it reaches to the lungs, this is the last structure of lungs, that is alveoli. Our air is reaching to the alveoli and sending the oxygen to the blood vessels. So blood vessels is passing from here, we can see. हम जो श्वास लेते हैं और वो श्वास हमारे सारे रास्ते क्रॉस करते 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 लास्ट में ये एयर सैक में आती है, इसका नाम है एल्वियोलाई, और इसी के पास से गुजरती है ब्लड वेसल्स। तो यहां से ये इसमें ऑक्सीजन डाल देती है। So when we are breathing, we are taking oxygen. It is crossing all the pathway and going to the alveoli, which is the last structure of the lung. And finally, what happened? This oxygen goes to the blood vessels. And in the return, the carbon dioxide is coming back. So this exchange is happening from the alveoli. So alveoli is the last structure of the lung. We can also consider like that. So this is the pipe. So this is like say grapes, bundle, alveoli, the last structure. So our air is going in these alveoli. So what happened? When this COVID-19 virus go inside, and this is the alveoli, it damages the inner boundary of alveoli and fill this alveoli with cough and phlegm. So now there is a lots of cough and phlegm is there inside the alveoli. So this become the pneumonia, which is having many types like lower pneumonia, bronchial pneumonia and all. So what COVID-19 do? COVID-19 do the phlegm formation in the alveoli. So if we do something, if we do some treatment to prevent this, to prevent the phlegm, to prevent the infection, then we can get the success. तो हमें सफलता मिल सकती है. अगर हम इस कफ को ना बनने दें या ये बने हुए कफ को निकाल दें तो हमें सफलता मिल सकती है. One last thing I would like to tell you. तो जब भी हमने श्वास को लिया, ये पूरी श्वास ट्रेवल करते करते एक लास्ट जो स्ट्रक्चर है लंग का एल्वियोलाई में पहुंची और इसने उसके अंदर कफ का निर्माण कर दिया या फ्लेम बना दिया. ऐसा क्यों हुआ? क्योंकि कोविड-19 ने इसके अंदर की दीवार को डैमेज कर दिया. Now, the blood vessels is passing from here. So now further this virus goes in the blood vessels and create little blockages inside the blood vessels. So there are two things happening because of the COVID-19. Number one, kapha in lung. Number two, blockage in artery. If there is a blockage in artery, it may create high BP and many other problems. So now if we can do something, for the removing kapha, if we can do something for removing the blockage from the arteries, if we can do something so COVID-19 virus cannot damage this much, then we can get the success. Then person having breathing difficulty, then person having breathing difficulty, suffocation, congestion, and fever. So let's see how can we do. Because nowadays everyone is discussing about the COVID-19. So all of us know these all things. But I felt that before proceeding, that I should do the little introduction about the COVID-19. Each of us know, सब जानते ही हैं कि ये क्या करता है, कैसे करता है. लेकिन इस इंट्रोडक्शन के द्वारा अब हम आगे बढ़ते हैं. So we can see many symptoms like coughing, dry coughing, shortness of breath, phlegm means cough, thakan lagna, fatigue, dryness, running nose, joint pain, headache, and oxygen level become low. We have seen all the things. ये सारी चीजें अभी हमने डिस्कस की. तो जब भी कोई कोविड-19 का पेशेंट होता है तो वेरी माइल्ड सिम्टम मीन्स सोर थ्रोट, गला खराब होना. ये गला खराब होता है अगर आप तभी अलर्ट हो जाओ तो यू कैन डील द पेशेंट वेरी फास्ट. लेकिन अगर वो सिम्टम बढ़ गए और उसको निमोनिया हो गया तो फिर उसे निमोनिया हो गया. द मीनिंग ऑफ निमोनिया मीन्स इन द लंग्स we are having right lung and we are having left lung. In the right lung we are having 3 lobes. In the left lung we are having 2 lobes. So most of the time it is affecting any one lobes. इसीलिए इसको लोअर निमोनिया भी कहते हैं, लोअर निमोनिया. Sometimes it affects all the lobes, then we tell bronchial pneumonia. लेकिन कभी कभी सिर्फ एक ही लोब को ये अफेक्ट करता है. So the first treatment, if you are thinking that it may be the COVID-19, so immediately do the quarantine the patient, isolate the patient, and tell the patient to measure the oxygen level and body temperature. Oximeter is very easily available on the surgical store. So just two things, thermometer and oximeter लेकर उसे अपने आप को सेल्फ क्वारंटाइन कर देना चाहिए. This is the first treatment. So now, so we have to discuss many points. Let's start our discussion from this point. पहले तो हमें पता होना चाहिए, we should have ideas that what are the who are very prone to get the infection. ऐसे कौन जो लोग हैं जिनको ज्यादा सावधान रहना चाहिए. So let's go to the Ayurveda. As per Ayurveda, if you are having good immunity, then no need to worry. Then no need to worry. This virus will affect you only if you are having poor immunity. So in the Ayurveda, it is very clearly explained there are 8 signs to have good immunity. In Ayurveda, it is clearly mentioned, there is a one slok, the name in the slok it is written, Tamaketu Virechanam. Tamaketu Virechanam. The meaning of this sloka, Tamaketu means tamak swas. Tamak swas means asthma and all the kapha disorders. If anyone suffer with any kapha disorders, अगर किसी को भी कफ का कोई भी रोग है, तो what is the first treatment? The first treatment is Virechan. The meaning of Virechan, that complete evacuation of the stool, means cleaning the intestine. The meaning of Virechan is cleaning the intestine. In the Ayurveda, it is clearly mentioned, if you want to treat any respiratory disorder, any respiratory disorder. Then first step, clean your colon. This is the first step. So if you are not constipated, if you are evacuating every day in the morning, evacuating every day in the morning properly, then this is the first sign of good immunity. But suppose you are constipated. So there are many remedies has been already given in the Ayurvedas. The one remedy is Trifla Rashayanam. One remedy is Trifla Rashayanam. In the Ayurveda, one sloka is there. It is written, Harad Baheda Avla. I am telling about the one, not sloka, one statement. Harad Baheda Avla जो घृत शक्कर से खाए, घृत शक्कर से खाए। आगे है उसमें, हाथी दबावे काख में और 60 कोस ले जाए. This is the statement of Ayurveda. I will explain you about this. कि if someone is eating harad, bahida, avla, these all together are called trifla. अगर कोई व्यक्ति रोज त्रिफला का सेवन करता है, trifla means 3 fruits. It is a combination of harad, bahida and avla, 3 fruits. So अगर कोई इन तीनों का सेवन करता है, if someone eat these 3 fruit combination, which is called trifla, how to eat? Mix little ghee and crystal sugar and have it every day. And even you can have it every day in the morning. Now the next, the harad vahida avla jo घृत शक्कर से खाए means the person who is eating the trifla with the ghee and crystal sugar, हाथी दबावे कांख में और 60 कोस ले जाए. The meaning of this, he will hold the elephant in the axilla. He can hold the elephant in axilla and can travel 60 kosa. And he can hold the elephant in axilla and he can travel with the holding elephant in the axilla 60 course near about 100 kilometers. So this is just why trifla. So trifla is the best medicine for cleansing your colon. And trifla is the combination of 3 medicine, harad, baheda and avla. These are the 3 fruits. Harad is a vata shamak. So it will clear the vata. So it is good for pain relief. The first one is good for pain relief. The second is kapha nashak. So if someone is suffering with cough and cold, with overweight, it will clear. And the third one is avla, is the pitta nashak. Means someone is suffering with the heat syndrome, like pimples, acne, hormone problem, any heat related disorders. So first one will clear the pain. Second will clear the kapha, and third will clear the unwanted heat in the body. So just by the combination of these three, Haran Vahida Avla means Trifla. So take 1 tablespoon Trifla and take 1 tablespoon cow ghee and take little amount of crystal sugar and have it in the empty in the morning. You can replace the crystal sugar with jaggery. But crystal sugar and jaggery. So many of my patients are taking the trifla plus jaggery, only trifla and jaggery. That's it. Every morning. So how they're taking? They are boiling the water and putting the trifla and jaggery there and 1 tablespoon trifla and little near about 20 gram of jaggery, and they are putting in the warm water boiling for 2 to 5 to 7 minutes and having every day in the morning. So if you take this, you will get good evacuation. Your colon will be clean. Then, as per Ayurveda, Tamaketu Virachanam, if your colon is clean, then your lungs will not suffer with cough and cold. Even if you compare as per the acupuncture, lungs and large intestine both are couple. If you do something with the large intestine, it will affect your lung. And you cannot imagine if someone is suffering with a cough and cold and asthma, you cannot imagine the rectification without cleaning the colon. अगर आपको ये पहला स्टेप तो पूरा करना ही पड़ेगा. So this is the first sign of good immunity, that you are having good evacuation and no constipation. The second sign of immunity, you are having no overweight. You should not have overweight. This is the second sign. If you are overweight, means you have unwanted deposition of fat, or we can tell undigested food. So if you are overweight, you are having unwanted deposition of fat or undigested food. And this undigested food and overweight and extra deposition of fat will give you laziness, lethargy, lack of enthusiasm. जब वेट ज्यादा आपका हो जाता है तो आलस आएगा और उत्साह कम हो जाएगा. In that condition, it will reduce your immunity. तो जो भी ज्यादा ओवरवेट लोग होते हैं, अगर आपका वेट जरूरत से ज्यादा है, so we can tell your immunity score is little lesser than the person who is having good muscles and who is fit. So how to reduce your overweight? If you are overweight because of the hormones, Then you can take the triphala powder, which I told you, and mix with tricadu powder. Both are available in the market. So 1 tablespoon of triphala powder and half teaspoon of tricadu powder, mix both together and have it in the morning. With the same pattern. If it is because of the hormones. But other than this, definitely you have to do the exercise. So if it is because of the hormone imbalance, with the help of exercise and this combination, you will see the significant relief. But if it is because of other cause, then we have to need some separate attention. We have to diagnose the cause. We have to diagnose the person and we can make the plan. Third thing of the clear sign of immunity, if your skin is bright, then it's so you are having good immune system. अगर आपकी स्किन ब्राइट नहीं है तो इसका भी अर्थ यह है बिकॉज स्किन ऑल्सो कमिंग अंडर द लंग्स, इसका मतलब है कि कहीं ना कहीं आपके लंग्स कमजोर हैं. If your lungs is good and fine, then your skin should be clear and bright. And for the skin, in the Ayurveda, there are lots of medicine available in the skin, and the very excellent medicine is the avla, which I already told you in the form of triphala powder. So if you are not lazy, now these 4 symptoms we already discussed. Now coming to the symptom number 5. If you are experiencing a strong sense of hunger, many times people are eating just because there is a lunch or dinner time. So they are eating. But if you are not having hunger sensation, then you can consider that you are suffering with the mandagini. If you are eating a lunch or dinner just as per the time, so it's so that you are having mandagini. What is mandagini? The meaning of mandagini means low digestive fire. So how to increase the digestive fire? In the Ayurveda, there is one powder. The name of that powder is panchakol. Or even we can take only trikatu. The ingredients are very, very similar, but we are having little more ingredient in the panchakol. So what we are doing, these both the powder are available easily in the market, panchakol or trikatu. So we can take 1 teaspoon powder, boil it with 2 glasses of water and till it remain 1 glass. Then use this water to cook your either dal or rice and do this procedure for minimum 7 days. Then you can stop it. So with this process, you will feel strong hunger. If you are feeling strong hunger, this is a sign of good immunity. And in the Ayurveda, this is called Deepan Pachan process. Deepan and Pachana process. You are going to the bed. As soon as you are going to the bed, you are feeling immediately deep sleep. It is a good sign of immunity. लेकिन अगर आप बिस्तर पर लेटे हैं, करवट बदल रहे हैं और आपको नींद नहीं आ रही है, it also show the poor immunity. If you are not getting sleep very fast, then what to do? You should get the sleep as soon as you go to the bed, within 5 to 10 minutes. In the Ayurveda, it is clearly mentioned कि अगर आपको तुरंत नींद नहीं आती है तो क्या करना है. इसके लिए एक ट्रीटमेंट है. द नेम ऑफ ट्रीटमेंट इज नश्य कर्मा. You have to take 2 drops cow ghee and put in both the nostril. Both nostril. For 7 days, you can do this process twice a day. And after 7 days, you can do this process only once a day. This process will give you benefit in 2 ways. Number 1, this is very good for sleep. And number 2, this is very good for lung disorder. तो अगर किसी को सर्दी खांसी कफ एंड कोल्ड है, ब्लॉक नोज है, उसमें भी हेल्प करेगा दिस नश्य कर्मा. और अगर किसी को नींद नहीं आती है, उसमें भी अच्छा काम करेगा. इन द आयुर्वेदा इट इज रिटन नासा ही सिरशो द्वारम, कि नाक ही सिर का द्वार है. नॉस्ट्रल इज द गेट ऑफ हेड. Nose are the gate of brain. So if you are putting the cow ghee in the nostrils, the meaning of this that you are tonifying your brain, so your brain will get boosting dose. So in this way, there are lots of things. Now I am directly coming. The last 2 points are, there should not be any pain in the body, and as well the status of the mind. So this was the little theoretical aspect. So let's see.